Okay, today I'm going to be talking about how to brush your teeth effectively and how to floss them effectively. Why do we brush and floss? Because we don't want to have any cavities and we don't want to have any periodontal disease. What is that? Gum disease, where your teeth become mobile and come out because of all the tartar and plaque on your teeth when you don't brush. Within 24 hours, usually the plaque forms on the teeth, and if you don't remove it, it becomes hard. And then at that point, the hygienist or the dentist has to remove it physically with like metal instruments because it's so hard. Okay, so today I'm gonna be showing you how to brush your teeth effectively. The key is effectively. We can be brushing, but not effectively, and it is very important to brush twice a day, in the morning and at night. You can brush after breakfast or before breakfast, but certainly before the bed is very important. And flossing also before you go to bed, okay? Because during the day you're eating all this food, bacteria is growing, the plaque is growing, food particles are on the teeth, so what you want to do, you want to remove it completely when you go to bed so it doesn't continue to do its damage. Because bacteria digest sugar and it causes acid production, and acid production, that's what causes cavities, okay? Also, certain bacteria also digest other particles of the food and causes periodontal disease. They're growing and that causes destruction of the bone, and then your gums receded, and we want to prevent that, okay? So I'm gonna show you how to effectively brush your teeth. You have to brush them inside, outside, and the tops, okay? So I'm gonna show you how to hold the brush. So this is how you hold the brush, okay? And then when you brush, you position the toothbrush bristles at the gum at 45-degree angle. It's very important that you position almost into the gum, you kind of push it into the gum, okay? And you can do either scrubbing motion and go in circles, but the toothbrush bristles have to be into the gum, okay? And put a little bit of pressure, not excessive amounts that you are kind of like, you know, tearing them apart, but sufficient enough that you could feel, you know, it's like almost massaging them, okay? You know, back and forth, and then you kind of roll it down. What this motion does, it cleans the between a little bit, okay? So you go back and forth, and then you roll it down. Put a little bit of pressure, back and forth, and roll it down. Back and forth, and roll it down, okay? That's outside, so you kind of go all around. You start here, back and forth, roll it down, back and forth, roll it down. You know, do like 5-6 times. 1, 2, 3, 4, 5, roll it down. 1, 2, 3, 4, 5, roll it down, roll it down. Now, when you brush your back teeth, you need to make sure that you close down your teeth so that the cheek would be able to stretch so you can get right along the gum line, because some people open really, really wide and you can't get to that area along the gum line in the back because they're open and the cheek doesn't allow you. So what you want to do, you want to close down a little bit so that your cheek stretches, and then you go also back and forth and roll it down, back and forth, roll it down. Okay, then we have to brush inside. The same technique, right? 45-degree angle. Can you see? Yeah. 45-degree angle, back and forth, roll it down, back and forth, roll it down, back and forth, roll it down. Now, inside it's hard to hold like that, so what I recommend for patients in the front, you brush up and down like that, all right? And then the same thing inside. On the other side, back and forth, roll it down, back and forth, roll it down. Now, on the tops, you also have to remember the plaque can build up in those grooves on the top, okay? So you want to make sure you brush the tops, back and forth, okay? Brush the tops. The same thing on the bottom. 45-degree angle, 45-degree angle. It's very important, okay? Because if you, bacteria and plaque builds right along the gum line in here, right along the gum line in here, inside, right along the gum, inside, in here, all those areas, that's where the plaque builds. And those are the areas you want to target when you brush. You want to make sure that you remove all that plaque, otherwise you can develop cavities in there and, you know, develop tartar and periodontal disease in the future. So we want to make sure we remove it where it builds up, okay? Right along the gum line, right along the gum line. That's the area we're targeting. Okay, so it continues the same thing on the bottom. These are circles or back and forth. And roll it up. Back and forth, roll it up. Back and forth, roll it up. Back and forth, roll it up. In here on the bottom, you don't have to worry about the cheek as much. You know, you can open so that you can get access, but on the top you do. And the same thing inside, right along the gum line, back and forth, roll it up, back and forth, roll it up. And then the front teeth, you just brush just like that, okay? The same thing here, 45-degree angle, don't forget, 45-degree angle, back and forth, roll it up. Back and forth, roll it up. Don't forget the tops. I'm gonna go tops and tops, okay? All right, so that's brushing. Now we're gonna go into flossing. Also, one more thing I missed. We need to make sure we brush our tongue. You can use the brush or you can use a tongue scrubber. Why is it important? Because bacteria also builds on our tongue, and it's one of the major causes of bad breath. You know, so if you drink coffee, some people are smokers, you know, if you eat sweets, you know, a lot of things. So bacteria and fungi can grow on the tongue as well, so you want to scrub your tongue as well. So it would be the same with toothbrush. You can use a brush or the scrubber, but the motion would be the same. You basically pretend this is your tongue. You just brush it like that, okay? Just like this, all right? So now the teeth are clean all around, but we still need to clean them between, right? It's like if you don't floss, basically it's like not washing between your fingers. You have to make sure that you floss. It's very important, okay? So this is a piece of floss. So what do you need to do? You need to take a pretty big piece, you wrap around the middle fingers like that, and then use those 4 fingers to guide it. This is how much space you need, okay, to be effective in flossing. Just going in and out doesn't do nothing, because there's a piece of gum that is not attached to the tooth or the bone, and you have to clean underneath there, okay? So I'll show you how to floss effectively, okay? So I'm gonna, you hold it for me, yep, thank you. Basically, you go in, you use those 4 fingers to guide it. You kind of go in, like in a seesaw motion, and you hug one tooth, and then you go under the gum. See, you have to go under the gum and kind of scrape it up and down. Then you go to the side of another tooth and you go up and down, scrape the side of that tooth, okay? And then you continue. You go under the gum, up and down on one side, and then under the gum, up and down the other side. And then you just continue, up and down, okay? And use those 4 fingers to guide it. You know, you can go either way, you know, and you can go in the back teeth, you might have to do this way, you know, when you go in it like that and you hug the tooth like that. Usually in the mouth, because we have cheeks on the way, we'll have to do like that motion, okay, with our 2 fingers like this, and thumbs holding the floss back there, okay, like that. You know, you go in the seesaw motion, and then you hug one tooth, scrape the side of it, and then another tooth, scrape the side of it, okay, and just continue. One side, and another side. Once you get a hang of it, it takes only a couple minutes, doesn't take long, maybe a minute even. You know, just go in, up and down, in, up and down, in, up and down, in. Make sure that you are going under the gum, because if you're not going under the gum, if you're going just like this, in and out, doesn't do nothing. It's not very effective, you know. So what happens, you know, people usually get under the gums, they get buildup of tartar and plaque, and gums start bleeding. So you still want, you want to go in, but you want to go far enough that you are getting all of the plaque and cleaning under that piece of gum that is not attached to the tooth or the bone. And we have to clean there, otherwise, you know, it's not effective. And effectiveness is the key. Effectiveness is the key. Just going up and down, seesaw motion. Ooh, really tight contact there. Ooh, some stuff is coming out. Watch that. Okay, so, and then you kind of toss out the floss. Also, people can use rinses if they want to, but I think effective brushing and brushing the tongue should take care of your teeth and keep them nice and healthy. So that would be my recommendation, that you brush them and floss them on a daily basis, morning and night, if you want to have a nice and beautiful smile.